The clinical significance of NIPT screening in pregnancy. It's a single center experience. So the NIPT is used to screen the fetal chromosomal abnormalities due to the presence of any aberration in the developing fetus. It is an NGS based technique which is based on cell-free DNA extraction from the mother's blood. So in this case we have included around 376 singleton pregnancies and 13 twin pregnancies. All were 10 plus gestational weeks and in the age group of 22 to 48 years. The clinical indications for most of the patients were high risk of trisomies found in biochemical screening and increased nuchal translucency or previous child born with Down syndrome as well as advanced maternal age. The patients were referred after sonographic and biochemical investigation by the concerned clinician at our reference lab. The clinical history as well as the family history of the genetic diseases were obtained. Cell-free DNA was extracted from the mother's blood and the approved concentration was measured, and the NGS was run using as per the manufacturer's instructions, and we have analyzed in a particular software pipeline version. The results were presented after interpretation using the Z-score. The Z-score for chromosome 13, 18, 21 lies between -6 to 2.8, and for autosomes like 1 to 22, the low risk pregnancy, the reference age is -6 to 6. The average fetal fraction in our case was found to be 12.11 in all the pregnancy cases. The high risk cases were only 5 were reported in our study and were genetically counseled. Pre and post test genetic counseling was done by our genetic counselor, and further invasive tests like UF-PCR and microarray using AF, amniotic fluid or CVS samples were recommended by the clinician along with regular clinical follow-up. So these were the 5 high-risk pregnancies found. We observe here all the clinical indications, fetal fractions, gestational weeks and types of pregnancy were given. The chromosomal aneuploidies were detected, trisomy 21 in 3 cases. In one case trisomy 3 was found, in another case trisomy 13 was reported, and these are the clinical indications as well as I already told. So the NIPT screening test basically is not a diagnostic test, it's a screening test. As per PCP and DT test, it is followed for reporting in India, and management of a patient with high risk pregnancy is a multidimensional approach and supported with the genetic counseling to reduce the psychological stress and anxiety of the patient. This test benefits not only the patient by omitting their need to undergo painful invasive procedure and helps the clinical decision making. Our study indicates that NIPT is a very effective approach to rule out the chromosomal anomalies at an early stage in prenatal screening, so that the early interventions can be planned for high risk pregnancy as per ACMG guidelines 2013 in India. So it should be done for all the high risk cases and wherever doubt is found as per the clinicians, and all the ACMG guidelines and recommendations are followed for this. Thank you.